So I welcome you all for today's session. A very good morning to all of you. So in this live series, which we have started on YouTube, I'm going to take important topics which are important for the university exam as well as MCQ point of view for the competitive exam and which are requested by the students. So many students have requested me to take a session on the screening of disease because many numericals come from this topic and students have problem in understanding the numericals and solving that. So today I will make this topic super duper easy for you. Okay, so without wasting any further time, let me come on the topic, that is screening of disease, in which I'm going to discuss all the numerical portion also in the end. So we will be discussing the sensitivity, specificity, positive predictive value, negative predictive value, all the important interpretation of the screening of disease. If you have any topic in your mind which you find difficult and which you like that I should take that topic on YouTube, I should discuss that topic, you can text me that topic. Okay, so let me come on the today's topic, that is screening of disease. I guess you can see my screen. Okay. Thank you so much. Thank you. Okay. So let me continue with screening of disease. Okay. So let me first come, what is screening of disease? First discuss what is the screening. What do you mean by screening? Okay. Now here is the community of the people. Okay. So here, if we apply now, how many type of people are there in this community? Let's divide the people into two groups. Let's divide the people in a community into two groups. Many of them are diseased. Maybe some of them are diseased. They are having some disease. And many of them are healthy. Okay, they think they are healthy. Okay, so we divide the people into two groups. The diseased people, they have the symptoms, they have the signs, and maybe they are diagnosed and they are on treatment. So they are having certain disease and they know it that they are diseased because they have symptoms for that disease. The disease can be any disease. And this is a group of healthy people. Okay, now the healthy people are actually not all of them are healthy. Okay, now healthy people are also of two types. Some are real healthy. They are actually healthy. They are real healthy. And some are apparently healthy. What do you mean by the term apparently healthy? Apparently healthy is a group of people, they think they are healthy, but actually they are not healthy. Actually, the disease has started inside them, but they do not have the symptoms. For example, if there is some disease inside my body, but if I don't have any symptom, how do I come to know that I am having certain disease in my body? So I will be thinking that I am healthy, but actually I am not healthy. I am having certain disease which is already started in my body, but it is not yet presented. So I'm undiagnosed. Maybe I'm a carrier. Maybe I'm, the disease do not have any symptoms yet. So this is apparently healthy group of people. So this is the basis of the screening test. Now you can understand we are applying screening test here. So we are applying screening test on a group of healthy people who think they are healthy to discriminate the actual healthy from the apparently healthy. This is the purpose of the screening test. Now you may be thinking, ma'am, why we are performing the screening test on a group of healthy people. The group of diseased people is very small. The group of healthy people is very big. You know, the population is in billions and we have a big group of healthy people. So we have to apply the screening test on all of them to take out the group of the people who is apparently healthy. Now, why we are doing so? You may be thinking that, ma'am, apparently healthy is a group of people who currently do not have symptoms because the disease is very small inside them. Once the disease will grow, they will have symptoms. Once the symptoms will be there, they will be shifted to this group. So why actually we are performing screening test on healthy people? To take out the group of the apparently healthy. Why? Because we want to offer them treatment before they present with the symptom so that the outcome should be better. If the people are coming to us with certain symptoms, so it's already symptomatic case, and here we will do the diagnostic test and we will provide treatment to them. Here in this group, the people are coming to us. The diseased people are coming to us because they are having signs and symptoms. That's why they are coming to the doctor for the treatment. Here people do not come to us because they don't know they have disease. Because disease is very small, they do not present, they do not have the symptoms. They do not come to us. We have to go to them. So we have to go to a people who think they are healthy, the group of the people, the community of the people, and apply screening test on them to see who is actually healthy and who is apparently healthy. Apparently healthy is a group of people who think they are healthy, but actually they are not healthy. So we want to offer them treatment before they present so that the prognosis, the outcome should be better. Now, this is specifically applicable in cancers, in oncology, where when the patient is presenting, it's already late stage, maybe stage 2, 3, 4. Here we can detect them in stage 1 also, and we can give the treatment, and outcome will be far better if they present at normal time in comparison to that. How many of you got it? Give me a thumbs up if you got it. This is the purpose of the screening test. So the purpose of the screening test to find out the apparently healthy people from a group of healthy people so that we can offer them treatment. Give me a thumbs up. You got it, everyone? So this is the purpose of the screening test. I hope you got it. Now, for the people who are actually diseased and who are actually coming to us, we perform diagnostic test on them. And here we perform screening test. If the diagnostic test is positive, we directly give them treatment. Okay, we directly give them treatment. Here we perform diagnostic test, but here we are performing screening test. Suppose if screening test is positive, we cannot offer them treatment. Screening test is not the basis of treatment. First, if the screening test is positive, we have to perform diagnostic test only on those who have positive screening test. And if the diagnostic test is also positive, then only we can offer treatment. I hope you got it. So this is the definition of screening test. What is screening? It is the active search. It is not passive. Patients are not coming to us. We are going to patient. We are going to patient to do the diagnosis because they do not have the symptom. So that's why it's the active search. It's not passive. When the patient is coming to our clinic, it's passive. Patient is coming. We are not going. But here we are going to the patients. Okay. For the disease among the apparently healthy people. Apparently word is important here. Okay. What is the aim? To find out the apparently healthy individuals so that we can offer them early treatment to have a better prognosis, better outcome. So this is the purpose. So we are performing screening test on a group of healthy people who think they are healthy. If the screening test is negative, they are actually healthy, and we have to do periodic screening after 6 months or annual or biannual, whatever. And if it is positive, we cannot offer them treatment directly. I told you, we have to confirm with diagnostic test. If the diagnostic test is also positive, then only we can offer treatment. So screening is not the basis of treatment. So please take it in your mind. Okay. So how you differentiate screening test versus diagnostic test? Screening test is performed on asymptomatic individual and diagnostic test is performed on symptomatic individual. So screening test versus diagnostic test. Screening test is performed on apparently healthy, who think they are healthy but actually they are not healthy. And diagnostic test is to do the diagnosis of cases. This one is done to do the diagnosis of these. This one is done to do the diagnosis of these. Okay. This is done on a group or a complete population. Here it is done on one individual. One individual is coming to us that I am having certain symptom. We will apply diagnostic test. But here we have to perform on complete population to find out who is actually healthy, who is apparently healthy. Here the results are final. It's arbitrary and the results are final. But in diagnostic test, results are not final. They are always modifiable. Here it is based on one criteria. Here it is based on multiple signs, symptoms, lab findings. This one is cheaper because we have to perform on a group of population. This one can be expensive sometimes because we have to perform only on one individual, not on group. This one is very rapid. This one can be time consuming. This is less accurate. This is more accurate. This cannot be used as a basis of treatment. This can be used as a basis of treatment. I hope you got the differences between the two. Okay, so screening test cannot be used as a basis of treatment. I told you very clearly. So there are many screening tests we perform. Anna. So for the cervix cancer, we do pap smear. For the breast cancer, we do breast self-examination or mammography. For the oral cancer, it is the examination, biannual oral examination. For HIV, ELISA is there. For diabetes, the sugar, the blood sugar and the urine sugar is there. Likewise, for different cancers, we use screening test specifically for the cancers. Because here the outcome can be, we can modify the outcome if we give early treatment. Okay, now you have to understand what is screening time, what is lead time before understanding the interpretation of the screening test. You have to understand what is screening time, what is lead time. Now please understand this time frame of a disease. Now just suppose I am the subject and inside me some disease have started. Okay, this is point A. And inside my body, some disease have started. Now, there is no test. As soon as the disease is started, it cannot be detected. It has to grow up a little bit. If I'm having some lesion, maybe the lesion is 0.00001 millimeter or centimeter. It cannot be detected. It is as small. It has to be a little bit grown up so that we can detect it. So the point at which the disease is doing the onset, we cannot detect it at that point. This is the first possible point where we can do it detection by any test. So this is the first possible point where we can do the diagnosis, we can detect the disease. So this is the point where the disease is starting in human body, A. It is known as A, for example. And this is the point where we can detect it the first time. This is point B. This is point B. Okay. Now this is usual time of diagnosis when the patient is coming to us. This is usual. If we are doing nothing, here the symptoms will come. When the symptoms will come, the patient will run to the doctor that, doctor, I'm having some problem, I'm having certain symptoms, I'm having some abnormality, kindly do the diagnosis and give me the treatment. So this is the usual time of diagnosis if we don't intervene, And here we offer the treatment and here is the outcome. The outcome can be good, can be bad, depending when the patient is presenting. So at that thing, the outcome can differ. So this is the outcome. Now between this, there is a point which is known as critical point. Now we want to diagnose the disease before the patient presents. When the patient presents, it's already a diagnostic test we have to apply. We have to apply a diagnostic test. We do not have to apply then a screening test. We want to diagnose the disease before the patient present. Before the symptoms, we have to do the diagnosis. So we have to do the diagnosis before that. Hannah. Now there is a point which is known as critical point. You have to understand what is this critical point. Hannah. We have to diagnose the disease before D. You understood that. Before this point. Hannah. But before this point also, if we are diagnosing in this period, after critical point, there is no change in outcome. Whether you are diagnosing here or you are diagnosing here, the outcome is same. So what is the use? What is the use? I mean, if you want to make a difference in the outcome should be better. You have to diagnose the disease before critical point and treat it before critical point. So critical point is that point which make a difference in the outcome. If you are diagnosing the disease after the first point of detection, but before the critical point, it is known as screening time. You have to diagnose the disease and treat the disease in screening time. Then the outcome will be much better or better as compared to usual presentation. When you give the treatment, the outcome is. How many of you got the concept of this critical point? It's very difficult. It's very difficult. Okay, so I'm trying to explain it in the most simplest way. You got it or you didn't got it? How many of you didn't got it? Shall I repeat what is critical point? Please understand it once more. I'm repeating. Please understand it once more. I'm repeating. Can you see here? This is the disease onset. Hannah, inside me some disease have started, but it's very small. We cannot detect it. This is the first possible point where you can detect the disease inside me with some test. So point A is the onset. Point B is the first possible point where we can detect it. Now, currently, I don't have any symptom. Now, the disease will grow. There is a point when I will have the symptom. So this is the usual time of presentation. When I have the symptom, I will run to the doctor. That doctor, I'm having some problem. Give me the treatment. So the doctor will provide me the treatment, do the diagnosis, give me the treatment, and there will be the outcome. The outcome depends on at what stage we are presenting. Okay, so what is the purpose of screening test? We want to do the diagnosis and treatment before this point. Before the symptom appears, we want to do the diagnosis as well as treatment. Now, there is one more point you have to understand, which is known as critical point. So we want to do the diagnosis and treatment in this period. That's why there will be a change in difference in the outcome. If you are doing the diagnosis and treatment in this period, there is no difference. Whether you are diagnosing here before the symptom appears, or you are diagnosing here after the symptom appears, there is no change in outcome. Then what is the use of that? You got my point? So this is the point between the first possible detection and usual symptom is known as lead time. And the initial portion of the lead time is known as screening time. The initial portion of the lead time is screening time. So it is not important to diagnose the disease in the lead time. No, it is important to diagnose the disease in screening time. The initial portion of the lead time is important. How many of you got it? How many of you got it? You got it? Can you respond? So you got the difference between the screening time and the lead time. Can you define what is the definition of lead time? Lead time is the time between first possible detection by any test. Between first possible detection till usual symptoms. This is lead time. Now the initial portion of the lead time is important. The later portion is not important, because if you are diagnosing the disease in the later portion here, in this portion, if you are diagnosing the disease in this portion, can you see? In this portion, so the outcome will be same if you are diagnosing it after the symptom. There is no change in outcome. So there is no use, of performing the screening test in this period or giving the treatment in this period. So you have to do the diagnosis and treatment before the final critical point. That is the time between the first possible point of detection till final critical point. So this is screening time. Okay. So the initial portion of the lead time is the screening time. So this is complete lead time. I guess you all can see it. See here once more. You can see the first possible point till usual diagnosis. This is lead time. And the initial portion of the lead time, this one is known as screening time. So you can define what is screening time, what is lead time, what is screening time. Screening time is the point between first possible detection till final critical point. This is screening time. First possible point till final critical point. This is screening time. And what is lead time? The initial point is same. They both are starting with the same point, the first possible detection till usual diagnosis. Till usual. So this is lead time. The initial portion is screen. So screening test is useful only when the lead time is more. The diseases which have a more lead time, then only screening test is possible, because you get a time to do the diagnosis as well as treatment here. If this lead time is very less, you don't have any time to do the diagnosis and treatment. The time should be more, so that at least you can do the diagnosis as well as you can treat, so that there is a change in the outcome. There is a difference in the outcome. That is the point. I hope you got it. Now we will do some MCQs and then we will come out the interpretations of the screening test. Read the question and can you tell me the answer? Can you read the question and tell me the answer? Screening test has following features except. Screening test has following features except. What is wrong for the screening test? It is done on apparently healthy individual, yes or no? It is less accurate as compared to diagnostic test. Test results are arbitrary and final, and it can be used as a basis of treatment, which is false. Which of them is false? Can you tell me which of them is false? Anyone? Which of them is false? Of course, it cannot be used for treatment. It is not a basis of treatment. I told you if screening test is positive, you have to confirm it by diagnostic test. You have to see the diagnostic test. If it is also positive, then only you can offer the treatment. Screening test is not a basis of treatment. Other three options are correct. I hope you all got it. I hope you all got it. The next question is in front of you. Can you tell me what is lead time? Just now I taught you. What is lead time? Between what and what? Between what 2 points? The point that the time is known as lead time. It is between the disease onset and first critical point. It is the disease onset and first possible point of detection. Between the first possible point of detection and final critical point, and between the first possible point of detection and usual time of diagnosis. What is the correct answer? What is the correct answer? What is the lead time? You want to see the diagram? This is the diagram. So can you see this is the lead time I'm asking? So it is the first possible point of detection and usual time of diagnosis. First possible point of detection and usual time of diagnosis. You can see, you can correlate. So this is the question, and it is a very frequently asked question. Lead time. Lead time. It is very important question. And the next question you already understood. What is screening time? From the same 4 option. What is screening time? What is screening time? So you can see screening time is the first possible point of detection till final critical point. So this is the answer. So from the same 4 option, I have asked you 2 questions. What is lead time? What is screening time? You must understand the difference between them. Okay, got it? Can we go ahead? Does anyone have any doubt till now? Now coming on the difficult portion of this session, that is interpretation of the screening test. So let me tell you what is the interpretation of the screening test. What is sensitivity? What is specificity? What is positive predictive value? And what is negative predictive value? Let me explain you. We will see their meaning. We will see their formulas and the numericals based on that. Okay. Now we are performing the screening test on this group. So we are dividing this group into 4 categories. Let me tell you what are the 4 categories we are dividing this group. Now this is the group. Now we have to make a table. Listen, from this group there are certain persons which have the disease. Now this all group is there and we are performing a screening test on them. Okay, they all think they are healthy. They all think they are healthy. But out of them, some are real healthy and some are apparently healthy. We want to differentiate between them. That's why we are performing a screening test on all of them. We are performing a screening test on all of them. So we have to make a table. Okay, listen. The top of the table always contain the disease. We have to make table like this. The top always contain the disease. It's a rule. And the left side, you always take the test result. You always take the test result on the left side. So disease is on the top. And the test results are always on the left side. It's the rule. Now first take positive, then take negative. Here also first positive, then negative. So you are dividing into 4 columns. I see you are dividing them into 4 columns. Can you see the 4 columns here? So this is a group of people who actually have the disease. They don't know they have the disease, but inside the disease have started. Okay, and the test result is positive in them. We want the test result to be positive in them. There is a group of healthy people and you are performing screening tests. You are counseling them and performing screening tests on all of them. Now, there is a group of people in which the test is positive and who actually have the disease. We call them true positive. We call them true positive. This is true positive. And both the things are positive. The disease is also there inside them. They don't have the symptom although. And the test result is also positive. This is true positive and we call them A. We denote them by A. Now, this is a group of people who don't have the disease, who are real healthy, who don't have disease, who don't have disease inside them. And test result is negative in them. So both the things are negative. We call them true negative. We call them true negative. We denote them by D. by the letter D. Okay, so learn true positive are A and true negative are D. Now, pity on these two groups. What are these two groups? Let's understand what are these two groups. Now, see this group in which the disease is negative. They don't have disease inside them, but by mistake, the test result is positive in them. Ideally, test result should also be negative. If they don't have disease, the test result should be negative. But there is nothing 100% now, Hana. By mistake, the test result is positive in them, Hana. So they will get anxiety that, oh my God, I'm having some disease inside me. But we will not offer the treatment directly. First, we will confirm them with diagnostic test. The diagnostic test will be negative, Hannah. But they will have certain anxiety and they will have fear. Oh my God, I'm having cancer. I'm having some disease which is already started. But again, it's a screening test. It is provisional. It is not final. We will confirm with diagnostic. Okay. So we will call them false positive because falsely they are positive. Falsely they are positive. They are not true positive. They are false positive. The test is positive by mistake. And we denote them by the letter B. We denote them by the letter B. Okay. Now what about this? They are also very unlucky. They have the disease inside them, but the test result by mistake, it's negative. Hannah, the test result is missing them by mistake. It's false negative. It is falsely negative. It is not actually negative. They are positive. They are positive. They have the disease. They will miss. They have done the screening test. That screening test will be negative and they will be very happy that, oh, I don't have any disease. But in future, they have that disease. And they will think, कि मैंने तो screening test भी कराया था. वो तो negative था. You got my point. So this group is denoted by C. I hope you got it. I'm telling you again. So always take disease at the top. Make a rule. The disease at the top. Okay, take the disease at the top and take the test result at the left hand corner. Always. And first there is positive and then there is negative. It's a rule. First positive, then negative. Here also first positive and then negative. Okay, so disease, test result, positive, negative. We are dividing the people into 4 groups. The 4 groups are in front of you. Okay. The 4 groups are in front of you. You can see the disease at the top and test result at the left hand corner. Positive, negative, positive, negative. Call them ABCD. A, B, C, D. The point is that you don't change the orientation, layout. If you don't change, you can learn ABCD. A is always true positive. You can see both the things are positive, positive. The disease is also there and test result is also positive. Hannah, D is always true negative. D is always true negative. Both the things are negative, negative. The disease is not there. The test result is also not there. The pity and unlucky people are B and C. Both of them are unlucky. You decide who is more unlucky. Here, B are the people who don't have the disease, but by mistake, the test result is positive. They are known as false positive. And C are the people who have the disease, but by mistake, the test result is negative. Okay, so these are known as false negative. So I divide the population into 4 groups. So this is a community. So ideally, if I am applying, they all think they are healthy. They all think they are healthy. So I have applied a screening test to see who is actual healthy and who is apparently healthy. So ideally, the screening test should divide them into 2 categories. The one who are real healthy and the one who are apparently healthy. Actually, the apparent healthy are the diseased. But actually, the screening test is dividing them into 4 categories. I want them to divide into only true positive and true negative. That's it. But nothing is 100%. No. All the tests do some mistake. There is nothing 100%, even not the Carnot engine is 100%. So none of the screening test is 100% positive or negative. 100% accurate, I mean. So there are certain mistakes. So there is false positive and false negative categories also there. So we are dividing the group of healthy and apparently healthy people into 4 categories. True positive, true negative, false positive, false negative. I hope you all got it. Say yes if you got it. So what is true positive? What is true negative? What is false positive, false negative? Can you tell me what is true positive? What is true negative? What is false positive? What is false negative? Can you tell me? We denote them by the letters. True positive is known as A and true negative is known as D. There is no confusion in that. Please learn that. False positive is denoted by B and false negative by C. If you don't change the layout in that table, I told you. So you have to see disease and you have to see the test result. Test ka result kya aaya? Which test? The screening test. What is the result? So if both of them is positive, it's true positive. They have the disease and the test result is also positive. We want that only. The person who have disease, the result should be positive. Here the person don't have disease. So results are negative. We want that. Okay. So this category is good. This category is good. But these two are unlucky people. The unlucky group of the people. Here in false positive, they don't have disease. But by mistake, the test result should be negative. But by mistake, the test result is positive. That's why it's false positive. And here they have the disease. So ideally, the test result should be positive, but it's not positive. Instead of positive, it's negative. It's negative. By mistake, it's negative. That's why false negative. So I hope you all got it. Give me a thumbs up if you all got it. If this concept is clear in your mind now, the things are very easy to understand. So I will explain you now. Now you are ready to understand what is sensitivity, specificity, positive predictive value and negative predictive value of a screening test. You will understand all 4 terminologies very correctly. If you have understood the concept of ABCD, never forget what is A, what is B, what is C, what is D. I will tell you the formulas in terms of ABCD. Hana? So always remember A is true positive, D is true negative. And you can understand also. Don't learn, don't mug up. Understand also. And B and C, B is false positive, C is false negative. And you can make it out. The disease based on the disease and the test results. You can make it out. I hope it's crystal clear. Okay. The same you can understand from this graph. Hana? So we are applying a screening test. This is the cutoff of the screening test. For example, there is a group of healthy people. They think they all are healthy. They don't have the diabetes. Hana? They all are healthy. But imagine some of them are already diabetic, but they do not know that. Hana? So I'm applying the fasting blood sugar. That is the screening test I'm applying. I will check the fasting blood sugar in all the people you can see in this diagram. Hana? I will apply the fasting blood sugar. My cutoff is 100. Hana? The people who are having the blood sugar, fasting blood sugar I'm talking. So it is above 100, they have the diabetes or they are in the pre-diabetic range. And the people who have it below 100 milligram per deciliter, they are non-diabetic. They are healthy, I mean. Hana? So my cutoff, I can take an, if I'm taking the blood pressure, my cutoff is 120 by 80. Likewise, I can take a cutoff. So all the people you can see above this, they are diseased. Above this cutoff. Okay, the cutoff can vary depending on disease to disease. And all the people below this cutoff are healthy. We are taking a cutoff. If it is blood pressure, we are seeing who is hypertensive. They all think they are healthy. But imagine some of them already hypertensive, but they do not know that I am hypertensive. So I will measure the blood pressure of all of them. So blood pressure cutoff is 120 by 80. So the one who is having equal or less than that, it's healthy. And the one who is having more than that is hypertensive, that is disease. So cutoff can vary depending on disease to disease. I hope you got it. So these all are true positive. Okay, these all are true negative. Hana? These all are true positive, these all are true negative. They have the disease and the test result is positive. They do not have the disease and the test result is negative. Okay, but there is a category which is false positive and false negative. You can understand. What is this category? Can you see this one? Let me tell you. What is this category? Can you see this category? This one. This one. So actually, they have the disease. You can see they have the disease, but they are below cutoff. By mistake, they are below cutoff. So they are false negative. They are false negative. Actually, they are positive, but falsely they are negative. And can you see this category? This one. Can you see this one? This one I am talking. This category. So they are above the cutoff. So they are positive, but actually they are healthy. You can see they are healthy people. Hana? But they are above cutoff. Since they are above cutoff, they are falsely positive. So in your exam, they can give you shading. Hana? What is this reason? Is it false positive, false negative? What is this reason? What is this reason? What is this reason? So in this graph, you should be able to identify what is A, what is B, what is C, what is D. I hope you can do so. I hope. So this area is A. A is true positive. Okay. This area is D. That is true negative. Okay. This area is B. That is false positive. And this area is C. That is false negative. So you should be able to identify which area is this one. They can give you shading and ask you the MCQs based on that. So this is the graph. I hope you all got it. Can we go ahead? Can we go ahead? Let me explain you what is sensitivity and specificity. Okay, let me explain you the two terminologies. Now, what is sensitivity? What is specificity? What is the numerator? What is the denominator in each of them? Multiplier is always 100. Okay, here also, here also. Now, see what is the numerator and denominator in each of them. Let's talk about sensitivity of a screening test. What is sensitivity of a screening test? Out of all the people who have the disease, which of them have the disease? Here the disease is present, here it is absent. So all the people who have the disease are A plus C. Out of all the people who have the disease, A plus C, how many of them the test is positive? In them, how many of them the test is positive? That is A upon A plus C. That is the sensitivity of a screening test. Hana? The disease is present in A plus C, but test is saying that disease is present only in A. In C, it is not detecting. So it is A upon A plus C. It is true positivity. It is the ability of a test to detect true positivity. That is known as sensitivity. Learn the formula A upon A plus C. What is A upon A plus C? Can you tell me what is A upon A plus C? What is A? True positive upon true positive. True positive upon true positive. What is C? False negative. So this is the formula. I don't recommend to learn in this terminology because you will forget, you will get confused. So learn A upon A plus C. It's easy to learn A upon A plus C, and you know what is ABCD. So you can always make out the formula. It's true positive upon true positive plus false negative into 100. And if you want to define, it is the ability of a screening test to detect the true positivity. So how many of them have disease? Say, ma'am, A plus C have the disease. But test is detecting only in A, not in C. So A upon A plus C. Say yes if you got it. This is the definition of sensitivity. This is the formula. What is specificity? What is specificity? Out of the people who don't have disease, B plus D, the disease is absent. In B plus D, in B plus D, the disease is absent. Okay. How many of them the test is negative? In how many of them the test is negative? It's D upon B plus D. So it is the ability of a test to detect true negativity. That is D upon B plus D. You got it? What is D upon B plus D? It is true negative upon true negative. Okay. And what is B? It is false positive. This is the formula. Don't learn in this terminology. You will get confused. Learn D upon B plus D. So can you tell me the formula of sensitivity and specificity? What is the formulas? Can you tell me the numerator and the denominator? What is the formulas? What is the formulas? So here learn A upon A plus C, and here learn D upon B plus D. This is the formula. And you know, I guess you know, A is true positive. So it's true positive upon true positive plus false negative. Here, true negative upon true negative plus false positive into 100. That is the formula of sensitivity and specificity. It's the ability to detect true positivity. It's the ability of a test to detect true negativity. Say yes. Give me a thumbs up if you got it. This is the definition, the formula of sensitivity and specificity. We will see the numericals also. Now let's come on the next two things. What is positive predictive value? And what is negative predictive value? Let me explain. What is positive predictive value? What is negative predictive value? Here also we have numerator and denominator. Okay, multiplier is always 100 in all these tests. The multiplier is always 100. Okay, now let me explain you what is positive predictive value. Now, how many of them the test is positive? The test is positive in how many of them? Say, ma'am, A plus B. In A and B, A plus B, the test is saying the results are positive. But actually, the disease is present only in A. Okay, that is the positive predictive value of this test. So out of them, the test is saying positive. Actually, the disease is present in A. So A upon A plus B. That is the formula of positive predictive value. You are getting it. You are getting the difference. And in how many of them the test result is negative? The test result is negative in C plus D. In C plus D. The test result is negative. But actually, the disease is negative only in D. The disease is absent in D. So D upon C plus D. That is negative predictive value. Okay, so I hope you are getting it. I hope you are getting it. So what will be the formula? Say, ma'am, true positive upon true positive plus here false positive, here true negative upon true negative plus false negative. So only denominator is changing. Got my point? So can you tell me the four formulas together? What is sensitivity? Okay. Before that, Hannah, here only I'm telling you all four formulas again. And then we will understand, write and see the numericals based on that. So can you tell me all four formulas together? See the easy way to learn. If you know how to make the table, the things are super duper easy. Start from the beginning. You know nothing. You know nothing. So start from the beginning, make a table. Make a table. Without table, you cannot solve it. Make a table. Disease at the top. And you take disease at the top. And you take test result at the left-hand corner. Okay. It is positive first, then negative. Here also positive first, then negative. So divide the population into 4 groups. Divide the population into 4 groups like this. Please divide the population into 4 groups like this. Okay. So this is the first thing you are going to do in your exam. The disease at the top, test results at the left-hand corner. Positive, negative, positive, negative. And always say A, B, C, D. Okay. A is your true positive. This is your true negative. D is your. This one is false positive and this one is false negative. Okay. Now say the 4 formulas. What are the 4 formulas? What is sensitivity? What is specificity? Tell me these 2 formulas. What is positive predictive value and what is negative predictive value? Start from the beginning. So what are these formulas? Can you tell me? Who will help me to write the formulas? So it's very easy if you understand. So what is sensitivity? Out of total people who have the disease, that is A plus C, how many actually have the, in which the test result is positive? So it's A upon A plus C. A upon A plus C. Got it? That is sensitivity. What is specificity? Out of them in which there is no disease. The disease is absent. That is B plus D. B plus D. In how many of them the test result is negative? That is D. D upon B plus D. So this is the formula of specificity. Now what is the formula of positive predictive value? Out of how many of them the test result is positive? That is A plus B. How many actually have the disease? So A upon A plus B. And what is negative predictive value? In how many of them the test result is negative? That is C plus D. Actually, the disease is negative in D. So D upon C plus D. So you can see, you can correlate in sensitivity and positive predictive value. The numerator is true positive. That is A. The denominator is changing. Okay. And in specificity and in negative predictive value, the numerator is true negative. That is D. And the denominator is changing. You can learn this way also. Say yes if you all got it. Everyone. So in this way, so sensitivity, specificity, positive predictive value, negative predictive value. If you know the table, it's very easy to create the numericals on the spot only, to create the formulas on the spot rather than learning and mugging up. Better to make the table in your exam and make the formulas. So if you want to make out the sensitivity, I'm repeating, if you want to make out the sensitivity, look at this line. So it is A upon A plus C. This is sensitivity. You can see here. And if you want to see specificity, it is D upon B plus D. This one. What is positive predictive value? This one. It's A upon A plus B. And what is negative predictive value? This one. It is D upon C plus D. How many of you got it? Give me a thumbs up. There is no easier way I can tell you. So in this way, you can make out and you can tell me the 4 formulas. Can you tell me the 4 formulas now? Can you tell me sensitivity, specificity, positive predictive value, and negative predictive value? Please appreciate it. You got it. Give me a gesture that you got it. So tell me the 4 formulas. Can you tell me the 4 formulas? Huh? So easy way. Sensitivity, the numerical is A. Positive predictive value, the numerator is A. Numerator is A. In specificity and negative predictive value, the numerator is D. That is false positive and false negative. Now denominator is something you have to learn in all 4. Here the denominator is A plus C. Here B plus D. Here A plus B. And here C plus D. This is how you have to learn. If you want to learn, it's good. If you don't want to learn, make it from the table all the ways I'm telling you. And you can make out. Always you can make out. In terms of true positive and true negative, if you want to create these formulas, you should know what is A, B, C, D. I guess you all know what is A, B, C, and D. A is true positive. D is true negative. B is false positive. And C is false negative. And you can replace all these here. So you will get those formulas also. I hope you all got it. Give me a thumbs up if you got it. So this is the 4 formulas in front of you without any confusion. You should learn it. If you understand it, what is sensitivity? A upon A plus C. What is specificity? D upon B plus D. What is positive predictive value? A upon A plus B. And what is negative predictive value? D upon C plus D. This is how I learn. And I know what is ABCD. In terms of true positive, true negative, I can always frame the formulas. So the 4 formulas, the summary is in front of you. The summary, the 4 formulas is in front of you. What is sensitivity? What is specificity? What is positive predictive value? What is negative predictive value? Please learn these formulas. The 4 formulas are in front of you. And in terms of true positive, true negative, false positive, false negative, you can always generate these formulas on the spot. Don't mug up. If you mug up these formulas now, you will forget. Try to mug up. If you want to mug up at all, learn these formulas. Rather, don't learn these also. From the table only you can create. Say yes. Huh? Got it, everyone? Hemant, Jyotsna, Hafsa, everyone got it? Anyone have any confusion? So learn the numerator and denominator in each of them. Ideal test should be 100% sensitive and 100% specific. But there is no test which is 100% specific and 100% sensitive. And sensitivity and specificity are inversely proportional to each other. If some tests have more sensitivity, the specificity will be low. If some tests have high specificity, the sensitivity will be low. They are inversely proportional to each other. I hope you are getting it. Now, one more thing on which you get the numericals. Please understand it from the formulas. Now, if you know the formulas, many things are clear. See the formula of sensitivity. See everyone on the screen. See this formula. What is the formula of sensitivity? A upon A plus C. I mean, true positive upon true positive plus false negative. You know what is A, what is C. Hana? You know. So can I say sensitivity is directly proportional to true positive? Yes. And can I say sensitivity is inversely proportional to false negative? Yes. So same thing is written in front of you. Don't learn. See in the formula and in the MCQs, in the options, you can always correlate. So you can say sensitivity is directly proportional to true positive and inversely proportional to false negative. Don't mug it up. It's obvious in the formula. Hana? What about specificity? What is the formula? The formula is D upon B plus D. You know the formula. That is true negative upon true negative plus false positive. So can I say specificity is directly proportional to true negative? Yes. And it is inversely proportional to false positive. Yes. So same thing is written in front of you. So don't try to mug it. You will get confusing options in the MCQs and students get confused usually. I don't recommend to learn all these. See the formula. I don't even learn the formula. I learn the table. From the table, I can make out everything. I can make out the 4 formulas. They are directly proportional. They are inversely proportional. Everything. Give me a thumbs up if you all got it. Give me a thumbs up. We are done. Huh? So finally, final summary, everyone on the screen. So if you want the 4 formulas, sensitivity, specificity, positive predictive value, negative predictive value, make the table. How to make the table? The disease at the top. It's positive, it's negative, like this. And the test results on the left hand corner. It's the rule. If you are doing the opposite, test results at the top and disease on the left side, everything ABCD will change. Everything will change. So test results on the left side. Again, first positive, then negative. And again, positive should be first and negative should be later on. So we are dividing the community or the population into four groups. Here, the disease is present, the result is also positive. These are known as true positive, that is A. Here, the disease is negative and the test results are also negative. That is true negative, that is D. So there is no confusion in A and D. This category is false positive, that is B, and this category is false negative, that is C. If you know this, the 4 formulas are very easy. What is sensitivity? A upon A plus C. Okay, what is specificity? D upon B plus D. Okay, what is positive predictive value? A upon A plus B. And what is negative predictive value? It is D upon C plus D. It is super easy game. Now, if you know the 4 formulas, you can always replace in terms of true positive, true negative. You know the 4 things and you can always tell me which is directly proportional, which is inversely proportional. That's it. We will solve some questions for your practice. See the question and tell me the answer. False negative means. What is false negative? You know the table now. What is false negative? These are the people who have the disease and the test result is negative. These are the people who do not have the disease, but the test result is negative. These are the people who have the disease. Okay, here disease is present, test result is negative. Here disease is absent, test result is negative. Here disease is present, test result is positive. Here disease is not present, but test result is positive. So which of them is correct answer? Are you getting it? I'm asking you the question. What is false negative? False negative are the people in which test is falsely negative. By mistake, the test is negative. Actually, they have the disease, but the test result is negative. So correct answer is A. They have the disease, but by mistake, the test result is negative. Now I can create 4 questions here. Yes, very correct. I can create. If I change the question to false negative to true negative, from the same 4 options, answer will change. So here disease is absent and test result is also negative. Here disease is present, test result is positive. Disease is absent, test. So if I ask true negative, so answer will be B. In that case, both the things are negative. If I say true positive, the answer will be C. Both the things are positive. And if I say false positive, the answer will be D. So I can create 4 questions here and it's a very common MCQ. So if you know the concept, you can solve it. What is the numerator of sensitivity? What's the numerator of sensitivity? Is it false positive, false negative, true positive, or true negative? What is the formula of sensitivity? Sensitivity is equal to A upon A plus C into 100. This is the formula. So what is A? It is true positive. So the numerator here is the true positive. Okay. So I can change it to specificity. The formula is D upon B plus D. In that case, answer will be true negative. Okay. So we can change the question accordingly. Answer will change. The next question is in front of you. The ability of a test to correctly diagnose. The ability of a test to correctly diagnose the percentage of sick people who are having the disease. So we are identifying the diseased people. The ability of a test to identify the diseased people. Is it sensitivity, specificity, positive predictive value or negative predictive value? So it is the ability of a test to detect true positivity. They are asking for the diseased people, the true positivity. Answer is sensitivity. So correct answer here is sensitivity. So we will solve some questions also, numericals also, read the question. Now, rather than only reading, I want you to make the table also. If you make the table, you can calculate sensitivity, specificity, positive predictive value, negative predictive value. I want you to tell me the values of ABCD in the table. By reading the question, try to interpret the values of ABCD. Once the values of ABCD are in front of you, you know the formulas you can apply. So please make this table with me. Please make this table with me. Fill the values of A, B, C, and D by reading the text. Okay. So a test of hepatitis C is performed for 200 patients with biopsy proven disease. So what is this 200? 200 are the patient. They have the disease. So how many people have the disease here? How many people have the disease? The disease is A plus C. So they are saying A plus C is 200. Total 200 people are there in which disease is present. The biopsy proven disease is there. And 200 are the patient which are known free of disease. So what is this? Another 200. They are the people who are free of disease. The disease is absent. So it is B plus D is also 200. So in the question, reading the language of the question, you should interpret the first 200 is A plus C and the second 200 is B plus D. Reading the question, you should interpret and you should make this table. Now read, the test show positive result in 180 of the patient. The test results. The test results are positive in 180 of the patients. So obviously C is 20 because total is 200. C is not mentioned everywhere. 180 is A. They are saying test result is positive in 180 of the patient. And the negative results on 150 of the patient without disease. The test results are negative in 150 without disease. And now 150 without disease. So here this one is 150. So obviously this one is 50 because total is also 200. Now you know the values of A, B, C, D. You can put the values. You know the 4 formulas. You put the values. It is not a mathematics class, so I am not at all interested in the calculations. You are done with ABCD value. That is more than sufficient for me. Now you can put your values and calculate which one is correct. You know the 4 formulas. I hope everyone knows the 4 formulas. Say yes, give me a thumbs up. So this is a way, Hannah, whenever you get a numerical based on sensitivity, specificity, positive and negative predictive value, you should interpret the values of ABCD. Reading the question, it is not necessary they will give you the table. So first try to make the table. By reading the text in the question, try to fill the values of ABCD. If the values of ABCD is done, it's super easy game. Now you know the 4 formulas. Whatever is asked in your question, you can put the formula and do the calculations accordingly. You do the calculations, the answer will be in front of you. Say yes if you got it. You got it? Now this is all about this, and this is the list of university exam questions. If you are preparing for your third prof exam, this is the list of university exam question, and we have solved the MCQs also. If you not want the notes of this session, there is a link provided in the chat box which is pinned. You can see the link right now, or it will be there after the session. You can click on the link and you will be diverted towards the notes. If you like the session, don't forget to click on the like button before you leave and press the bell icon if you want further notifications. Okay, now here is the QR code. You can scan it, and if you scan it, you will be diverted towards the website that is MedLive by drpriyanka.com, and you can connect with me on various social media platforms, that is Instagram, Telegram, WhatsApp, and there I share many education stuff which is related to your education, medical education, which is useful for your exam. So if you want, if you are interested, you can do so, and you can connect with me on various social media platforms. And here is the contact number for your doubts. If you have any doubt, any query related to anything which I'm explaining, and if you have any topic in your mind and you want me to take that topic on YouTube, you can text me. It's only for the chat support, not for calling. So here is the contact number. Here it's 9321001485. This is the contact number. Thank you for your patience, your time, your attention. Our next session is on 18th. On 18th and 20th, we are taking the pharmacology. Every Monday, Wednesday, Friday, we are taking the session at 9:30 a.m. in the morning. So the next session is on 18th of December. That is pharmacology topic, very important topic, protein synthesis inhibitors. So don't dare to miss it, 9:30 a.m. on the 18th. Okay, thank you so much for your patience, for your attention, and I'm ending the session. Thank you so much. Thank you. Bye-bye.